The guests and discussions on this show are not endorsed by the show or show host. The content is provided for informational and educational purposes only. Nothing you hear is intended to substitute for medical advice, diagnosis, and/or treatment by a qualified health professional.
Welcome to Health Revolution with V, your integrative health adventure. Welcome to the Health Revolution with V show. I am so excited. I have an amazing guest for you today. A little housekeeping. I just want to say that to see any of the Health Revolution with V episodes, you just need to go to eatingwithv.com. If you're on a podcasting platform and you want to see the video of it, again, go to eatingwithv.com. You can see the video version. And without further ado, I want to introduce my incredible guest today. It is Dr. John Grassam, and he is a second-generation chiropractic physician who has been treating people on the Treasure Coast for almost 25 years. He specializes in helping people suffering with back or neck pain caused by bulging or herniated discs, which is probably most of us. His office utilizes the latest technology in non-surgical spinal decompression, which is why he's here on the show. We love the non-surgery part of that, for the treatment of disc injuries. Dr. Grassam owns the Disc Centers of America in Port St Lucie, Florida. That's DISC, Disc Centers of America, and he's located in Port St Lucie. So without further ado, welcome, Dr. Grassam.
Thank you for having me.
We're excited to have you here on the show.
Thank you.
Spinal decompression is one of my favorite things, so let's jump right in. Can you tell us what is spinal decompression?
Sure. So spinal decompression is an FDA-cleared technology that is basically non-invasive, non-surgical, to help people naturally with neck pain, back pain, maybe pain radiating down an arm or a leg. And generally those things are caused by disc bulges, disc herniations. If they're there long enough, it can certainly generate what we call disc degenerative disease or disc joint disease. Those are the common terms that people hear. And so it's a safe and effective way of trying to treat those things without surgery.
I love that. Can you explain a little bit about how that looks? Like, what does that look like when someone comes in and has a spinal decompression?
Sure. So true decompression, there is actually, it's a fairly large table, but there's a fixed tower. So true decompression has a fixed tower because we have to set the angles depending upon which disc we're actually trying to target. So if I'm utilizing the lumbar spine or the low back as an example, they're basically a table that they're harnessed in. So there's a lower body harness, there's an upper body harness, and we set the angle depending on which disc we find is the problem, and we target that disc, and then basically the machine just gently pulls, it holds, and it releases. Very gentle, very non-invasive. And what we try to do is try to milk that disc, that swelling of that disc, back into place off of the nerve root or sometimes even the spinal cord if it's pushing back that far.
I love it. I do have to divulge that I have had spinal decompression in the past because I did have disc issues. We had talked about that. And it is an incredible treatment for disc bulging and pain like that. So that's exciting. And non-surgical. You know, if your doctors are giving you that, hey, you have to go have a surgery, they can come and see you prior, right?
Absolutely.
And you can probably help them.
Absolutely. Our goal is to actually try to help them avoid surgery.
Right.
People don't realize that the overall long-term success rate of surgeries is not that great. Some of the top neurosurgeons do. I've had neurosurgeons around the area who will tell their patients, only when you're in severe pain and you can't stand it anymore, do you come to me? And I appreciate and respect those doctors for making that decision. And that's when hopefully people will actually find me before they even get to that point.
Right. And we're hoping to help people find you too, because
Absolutely.
I think it's so important. What actually causes those discs to bulge and herniate?
So there's a lot of different things that can cause a disc to bulge and herniate. Contact sports for young boys, football, wrestling, any kind of contact sport. And for girls, that can be gymnastics or cheerleading. Slip and falls. A common one that I see a lot of is from automobile accidents. I've treated thousands of people over my years in automobile accidents, did postgraduate training in whiplash, participated in live human crash testing. And one of the things that we learned in that was that even in low speeds where there's very little vehicular damage, the G-forces that are generated from low speed crashes are significant enough to tear and stretch connective tissue. That connective tissue, of course, includes the discs. So the ligaments that surround the spine, the discs that sort of act as spacers and shock absorbers in between the spine, if those things get damaged, that's many times where they bulge, they swell out, they herniate, they hit those nerve roots, and of course, that's when people start feeling pain.
Oh, and those pains are awful.
Yeah.
I know that when my back goes out, because of the injury's always there, but when the back goes out, like I'll get that pain radiate right down my leg, and it is not fun. But I feel it before it happens, so I make sure I get in and get something done. So how does the spinal nerve root compression affect the body?
So for most people, they may get that pain, and that pain that they get is their first notification that there's a problem. And, it's different for different people. So for some people, it's just back pain. I've literally had patients who have back pain with disc bulges or disc herniations. I've had people with no back pain, but they have radicular symptoms going down the legs, or, if it's in the neck, it's going down the arms. But there's a bigger picture there too, because the nerves that come off of that spine and go through those nerve roots, they end up in tissues and organs as well. So you don't want any pressure on those nerves. Any pressure on those nerves can begin to affect that communication between the brain and the body back to the brain. It's just pain is one of those things that people focus on because obviously it gets their attention.
Sure. And people, I don't think, realize how. I know that when I had my accident, I was, a teenager. And it actually affected my stomach. So you talking about that is so vital. Someone could be having an issue with your stomach, and it could be coming from their spine, right?
Absolutely. That's why doctors of chiropractic focus on the spine. Our goal is, to the layman, it's he pops my neck or he pops my back. But there's a bigger picture than that. Whenever I ask a patient, what is it doctors of chiropractic do? Of course, that's the very common answer you get. And then my next question to them is why? Why do we do that? And ultimately, our goal is to improve neurological function by getting the joints of the spine moving better again, because not only are those joints innervated, meaning they have a nerve supply, but they also can affect the disc as well, because if you create dysfunction in the joints themselves, you begin to interfere with the pumping mechanism that helps keep the disc healthy.
Wow. There's so much more. Like just when I think I know some things, I find out I don't. When Dr. John Grassam comes on the show, it's like, I didn't know nothing. I think that's great, though. This is information that people need. So in a recap, by the discs bulging and herniating,
correct,
your work, that spinal decompression, is actually going to pull those gently apart and relieve that pressure, right?
Correct. Absolutely. So if I may, I'm going to bring this up. Yes. I know we're on a podcast here, but hopefully I can get this in the picture.
Oh, you're on a video cast too.
Okay. So in essence, the disc acts like a spacer, and it acts like a shock absorber. It keeps this hole open, and as these nerve roots come off the spinal cord, they go through these holes. We call them neuroforamen, just means hole for nerve. Doctor language, it's always fun. But when these discs get injured and the walls get weakened, the disc actually can swell out. So as I squeeze down on it, you can kind of see what would be a circumferential disc bulge. If the pressure of the damage is enough, I'm actually going to squeeze this out, see if I can get it there. You can actually see the disc beginning to herniate right out there. And of course, where it herniates towards in this case would be the left nerve root. Now on an MRI report, certainly that would reflect that there's narrowing or stenosis of that neuroforamen. And of course, if it touches that nerve root, the patient generally has pain.
Oh, yeah. And that pain is brutal.
Can be.
Oh, I know people, when my sciatic goes out, it can be so, so brutal. Thank you for sharing that.
Sure.
I think that if you are on the podcast version, I think that you may definitely want to join us on the video cast version so that you can see that. Can you, before we take a break, can you share how people can find you?
Sure. So I'm located off of St. Lucie West Boulevard in Peacock in the Lake Whitney Medical Professional Campus. They can certainly go to my website, portstluciedisccenter.com. There's a lot of great information on there on decompression. There's some information even on epidurals, which is sometimes the route they go before they do surgery. I've posted on there a show that Dr. Oz did on epidurals and expose. A lot of people are not aware that epidurals are not FDA approved. They are utilized what they call off-label use. And so there's certain risks that are attributed to, injecting corticosteroids in and around or near that spinal cord. And a lot of people are not aware of that. So I always like to just kind of give them that information and let them know there's a safer alternative.
For sure. When we come back from the break, I would love to touch on that a little bit more.
Sure.
We're going to go ahead and take a quick commercial break for our commercial sponsors, who are the ones who makes this show possible, and have Dr. Grassam here today with us. So don't go away. We'll be back in just a moment.
Apex Electric is a family-owned and operated, licensed and insured electrical contractor with over 30 years of experience. No job is too big or too small. With free estimates and a 1-year warranty, Apex Electric is your premier contractor on the Treasure Coast. AAPEXelectricinc.com.
Dr. Shelley Anderson, with Terrapin Chiropractic, proudly serves the Treasure Coast of Florida with high-quality chiropractic care for all ages utilizing the Gonstead chiropractic technique. You can connect with Dr. Shelley at terrapinchiro.com. That's TERRAPIN Chiro.com.
At Your Body Bliss, our passion is creating handcrafted bath and body products for your entire family. From our hand-poured soaps and authentic Castile soap to incredible lotions and more, all made with ethically sourced quality ingredients. With love from our family to yours, yourbodybliss.com.
Have you been told that you need to cut way back on sugars due to a health condition? Do you find yourself struggling to give up the sugars even though you know your health depends upon it? If you answered yes, my online Hidden Sugars class is for you. Take charge of your health and visit eatingwithv.com and take the class. Welcome back to the Health Revolution with V show. We have Dr. John Grassam here. I don't want to waste a whole lot of time because he has so much great information. If you missed the first part of the show, please definitely go back and listen to the beginning. He had so much to say, and we're going to get right back to it because I know he has a lot more to say. So welcome back to the show. So tell me, how do you diagnose the disc bulges and disc hernias? How are they diagnosed?
So traditionally, when people have pain but they don't know what the cause of it is, whether they go to a medical physician or a chiropractic physician, the gold standard for most doctors is to turn to the X-ray. And I've had patients come to me and say, "Oh, my doctor says I have a disc problem," and I go, "Okay, well, did you do an MRI?" And the answer is, of course, no, they haven't yet. And so you can't see what's going on with the disc on an X-ray. You can see the space that it creates or the lack of space if it has been desiccating or drying up. But generally, the best tool to actually diagnose that is the MRI, unless there's some extenuating circumstances as to why somebody can't do an MRI. At that point, you're ordering a CT scan.
Right, right. And MRIs are great. And listen, if you don't have insurance, I'll tell you only because I know from knowing some DPC doctors, direct primary care, is that you go in as a cash pay and it would be probably less than if you used your insurance. So
the headaches sometimes of dealing with insurance, yes.
It's kind of crazy, but so the MRI is the tool. That's the one that would help them see that.
It is the best tool to assess the connective tissue or the soft tissue, to look at the disc to see, is it bulging, is it herniated? There's a few different types of injuries that can occur to the disc. The disc can actually extrude, where the wall of the disc, what we call the annulus fibrosus, actually tears open, and then the jelly sort of filled center called the nucleus can actually begin to ooze out. And each one of those is a greater injury to the disc and usually requires a little bit more time to actually get it better. And you definitely want to get it better before it extrudes so significantly that, we talked about pressure on the nerves before. In sometimes disc extrusions or disc, what they call a sequestration, where a fragment of the jelly breaks away from the main mass, when that occurs, if it puts enough pressure on the spinal cord, you can start to interfere with leg function, like if we're talking about the low back, or in severe cases, even what they call cauda equina syndrome. Cauda equina syndrome is where a patient starts having issues with bowel and bladder function. Oh. And those are severe. So if you get to that point, that's usually get them to the hospital, and at that point, it's got to be some sort of surgery to get that pressure off, because you don't want that kind of pressure on the nerve, spinal cord.
Goodness.
Yeah.
So if it starts to break away, like you said, like pieces of the jelly break away, is it possible with spinal decompression to relieve that pressure to where it would heal, or is surgery really the only option at that point? At
that point, each case is taken on a case-by-case basis. Usually when there's sequestration, at that point, I'm probably going to tell them to go see a neurosurgeon. Wow. Because when a piece of the mass is broken away from the main mass, you have to remember that now it's technically separated. So the goal of decompression, when we decompress that disc, is to create something called the vacuum effect. So decompression actually creates a negative pressure inside of the disc, no different than your vacuum cleaner will suck stuff off the floor. As we create that negative pressure inside that disc, it sucks back that herniated material, or that sometimes even that extruded material, and the disc does have the capacity to heal. When you get to a point where that disc is actually sequestered and a piece of it's broken away, many times it's free to travel. Oh, wow. So it can travel up the spinal cord, it can travel down the spinal cord, but either way, you don't want that piece doing that. So For me, most likely I'm going to err on the side of caution and refer them to a neurosurgeon.
Right, right. Now, one more question on that as well. I actually just had a senior moment, and I forgot what I was going to say.
Was it about epidurals?
No.
No.
But anyway, so I'm going to move forward. Let's talk about the treatments.
Okay.
So standard treatments actually, I knew my question, preventative. So as a preventative measure, you could work with clients on a preventative basis. What would that look like if they wanted to find out like early on and work with you?
So, I always, generally after a patient goes through a treatment program, I usually recommend a maintenance program for them. And the reason why is because they have to understand these discs have been changed. They are altered. There's no going back to normal, right? We don't make the disc and wave a magic wand and all of a sudden it's completely normal again. So when over the years, I've had patients say, "Oh, you cured me, doc," and I'm not a big fan of that word. I let them know we are controlling and containing a significant issue, right? The disc has the capacity to heal, and the more we can get it sucked back in, then the body has the capacity to heal that disc. And if you can heal that disc, then of course they're better, but that disc has still been altered. And that's the thing many times, like car accidents, for example, they change us on the inside. There's scar tissue in there. And we're never the same again. And that's what people don't understand, especially if they had an injury years ago. Years ago, they had a lot of pain. Maybe the pain went away. And then they think, oh, the pain went away, the problem's gone. And it's not. Many times it's laying dormant. And then all it takes is some sort of additional stress, improper lifting, sports injury, fall off a ladder, you name it. And it makes it worse. And then they're looking for help.
Right. Or even just grabbing a hanger out of your closet. I mean,
sometimes it can be that simple.
Something crazy.
Yeah.
Don't go away. We are going to take a quick commercial break to thank our commercial sponsors for this show, and we'll be back in just a moment.
Awakened Mind, powered by BrainTap, is the ultimate relaxation and focus solution. BrainTap helps reduce stress, improve focus, and enhance relaxation effortlessly. Enjoy better sleep and overall well-being. Try BrainTap today at tribelifecoach.com.
Interstate Express Incorporated is your local and statewide 24/7 courier service. Woman-owned and veteran-friendly, serving the entire state of Florida since 1990. We pick up and deliver anything from an envelope to a 5,000-pound load. Give us a call, 772-287-2137. Interstate Express.
Are you looking for an action-packed adventure? We have unforgettable birthday parties, events, and more. Bring your family, bring your friends, and join us at Port St Lucie's only paintball park. Call 772-812-0000 or visit invinciblespaintball.com.
Is your insurance company telling you that you have to replace your roof? Nice Roofing is a family and veteran-owned and operated local business. Choose peace of mind and quality work with this Owens Corning Platinum Certified contractor. Join thousands of satisfied customers. Visit niceroofing.com. Welcome back to the Health Revolution with V Show. We're here with Dr. John Grassam. If you've missed any part of the show, please go back and listen. He has so much great information, and we're all learning here today from him. So without further ado, welcome back. Welcome back, Dr. Grassam. So talk to us a little bit about what some of the standard treatments look like for disc injury.
So traditionally people, they'll try to self-treat at home. They might try some medication, some ice, stretching, rest, hot baths. If that doesn't work, then a lot of times they could end up with a doctor of chiropractic or a doctor of medicine. But if they were to go to their PCP, oral corticosteroids are generally the first go-to, along with painkillers and muscle relaxants. The problem with those things is they just address symptoms and they don't address cause. And that's ultimately what we always want to get down to, is what is causing the problem, right? And I understand pain, I promise you. I had very severe injuries as a teenager. I herniated 3 discs in my low back in a bad motorcycle accident that over the years have extruded themselves. And of course, that's one of the reasons why I even do decompression on myself. But if that doesn't work, then a lot of times they get sent to a specialist like an orthopedic surgeon. And that's where those epidurals come into play, right? They're trying to help people, and I get it. But the reality is, again, with all due respect, they're trying to reduce inflammation, but they're not addressing what's causing the inflammation. And so if those epidurals don't work and it continues to progress, or if the patient's in a lot of pain, then the next step is surgery. And that's where I try to get people to understand there's a logical step here, right? Surgery should always be a last resort. You should exhaust all measures. And unfortunately, because Western medicine really runs a lot of back pain through pharmacological approaches, a lot of people think that's the only avenue they have.
Right.
And so my goal is to obviously get the information out there that there's alternatives, and the overall effectiveness of non-surgical spinal decompression, depending on which study you look at, is somewhere between 71 and 89%.
That's
generally what
amazing.
I'm seeing in my practice, closer to 90%.
Well, and then not being on the pain medications. You know, I did have another question on the epidurals. So what are the risks of people? Like, I can't imagine somebody putting something into my spinal column. So can we talk a little bit about the risks of doing that?
Sure. So I'll start with a story. I had a gentleman in my practice probably a couple of months ago who had about 5 back surgeries. And on his 3rd epidural, he developed an infection. And of course, if you get an infection and it develops into sepsis, that's a systemic infection, which obviously can lead to death. So not to scare people, but he ended up in the hospital, I believe, for a couple of months on high-dose antibiotics. And even when he had come to see me months later, he was still on a low-dose course of antibiotics. So, you know, there are contraindications to doing non-surgical spinal decompression. Of course, we have to figure out, is the patient a candidate for the care? And in some cases, unfortunately, I don't like to turn away anybody. There can be alternatives that we might be able to do to help them with pain relief. But at that point, sometimes they're not a candidate for non-surgical spinal decompression. So the risks of epidurals can be strokes, can be paralysis, can certainly, if you develop an infection, because that's a very important area that, to me, we don't want to go there unless we have no other choice, like in an emergency situation. Because, you know, the one thing about the spinal column is you have CSF, cerebral spinal fluid, that actually bathes the brain and bathes around the spinal cord, and it's pumped around. And so people can even develop leaks from those things. So it really depends. And I think one of the best ways to give people a little bit more information is if they go to my website and they log in and they find Dr. Oz's show, because he did an expose on that whole subject. And they can get a lot more information than just what I'm giving them here.
Give them the website again, can you?
Sure. It's Port St Lucie disccenter.com.
That's Port St Lucie Disc Center, PortStlucie, disccenter.com. So there's a lot of great information then at your website.
Absolutely.
So who is the ideal candidate for a spinal decompression?
Well, anybody that, you know, has a disc bulge, has a disc herniation. Many times, again, they find me after they've gone down. You know, I get people go onto my website, and sometimes they'll fill out forms that'll basically say, hey, my back pain's an 8 or a 9. You know, I've got pain going down the leg. I've had an MRI. I've had X-rays. I've been to my primary. Even some of them have been to doctors of chiropractic. You know, and they're not getting any kind of relief. And you know, maybe they've been to an orthopedic surgeon and they're not getting any kind of relief, and they're just searching at the last minute. They've done epidurals. So disc bulges, disc herniations, degenerative joint disease, degenerative disc disease, these are terms they're really medical terms, and I always try to educate my patients. I let them know that these are not diseases that you catch, right? They're diseases that are created from the damage that has occurred to you from the things that have happened to you throughout the course of your life. Mm-hmm. You know, I've taken X-rays on 70-year-olds, 80-year-olds, and some of them sometimes have areas in their spine that actually look better than some of my 40 and 50-year-olds. Wow. So it's what I try to tell my patients is damage creates dysfunction, dysfunction creates degeneration.
Right. So best to go and do preventative, make sure that you get in. I want to say thank you so much for being on show. I could talk to him for another 2 hours probably, but Jesse's yelling at me right now. So thank you so much for coming on the show.
Thank you for having me.
We so appreciate Dr. Grassam, Disc Centers of America in Port St Lucie, and it's PortStLucieDiscCenter.com. Make sure you check out the website, and we will look forward to seeing you on the next episode of Health Revolution with V. So